The prevailing narrative surrounding divorce often concludes with the signing of legal documents, a final, decisive action. However, behavioral psychology reveals that this judicial endpoint is merely the start of a profound, turbulent, and nonlinear psychological overhaul. For the former wife, the split is not an event to be mourned and forgotten, but rather the activation of a complex adaptive mechanism that can take years to stabilize. Understanding this journey requires moving beyond superficial observations and analyzing the acute psychological risk, the sustained chronic stressors, and the eventual mediated path towards self-reorganization. Recent behavioral genetics studies underscore the gravity of this transition by demonstrating that divorce is often not just an environmental cause of distress, but an outcome tied to pre-existing vulnerabilities. Individuals who experience divorce, particularly women, exhibit higher genetic risk scores for psychiatric disorders, including anxiety, depression, and substance use disorders, even if they have never developed the condition itself. This suggests that the emotional crisis of separation acts as a severe environmental trigger, activating latent vulnerabilities and elevating the clinical complexity of post-divorce adjustment beyond typical grief. The initial period following marital dissolution is clinically defined by a high risk of psychological maladjustment, encompassing depression, generalized emotional distress, and mental illness. Divorce is universally recognized as a valid form of grief, and like mourning a death, the 5 stages of grief, including denial, provide a starting, though non-linear framework for understanding the process. The emotional intensity of this period typically peaks within the first 6 months, though the grieving process often takes as long as 2 years to substantially mitigate. For women, this stage presents a significantly amplified risk profile. Analysis of population data indicates that women are at a heightened risk of receiving a mental health diagnosis compared to men following divorce. This vulnerability is acutely compounded by socioeconomic factors. Financial insecurity is directly associated with decreased sleep quality and subjective health, with women reporting emotional distress showing a lower average life satisfaction score of 6.27. Moreover, low income significantly amplifies the risk of mental health diagnosis for divorced women. Behaviorally, the most profound challenge faced during the acute phase is the disruption of the self. Individuals often experience a loss of self-continuity related primarily to their lost spousal and parental roles, perceiving that important parts of their constructed identity have been lost, and the future self remains vague. The fundamental psychological work required is identity reappraisal. Behavioral evidence suggests that while this feels overwhelming initially, the perception of the post-divorce self becomes a choice. Successful navigation involves redefining identity by accepting divorce-related experiences as integrated parts of the self. This acceptance helps manage intense emotional reactions and enables the continuation of life. Beyond the acute emotional trauma, adjustment is compromised by the relentless accumulation of daily challenges, a phenomenon described by family stress theory as the pile-up of multiple stressors. These stressors include logistical obstacles, continued financial burdens, and the requirement to restructure social networks. In the context of parental distress, research indicates that the effects of persistent daily negative events can be greater than those of the initial major event. Financial strain is one of the most common and persistent triggers, often initiated by predictable events, unexpected expenses, or the loss of expected supports. This continuous load of stress negatively impacts effective functioning. Mothers experiencing high negative life stress are prone to perceiving their children's behavior as more deviant and often exhibit less affectionate and more punitive or irritable parenting styles. A further complication is the relational challenge of disentanglement. Divorce results in documented losses in overall network size and support, frequently leaving unmet needs for emotional support. Furthermore, the former partner remains an active network partner. Studies show that women are exposed to risk for a longer duration than men, largely due to men's quicker repartnering. This interpersonal shadow complicates the woman's necessary work of reorganizing her sense of self and developing independent coping strategies. Despite the formidable adversity, the experience of divorce often catalyzes resilience and post-traumatic growth, which involves a constructive psychological shift leading to greater maturity and an enhanced appreciation for life. This growth, however, is not automatic. It is mediated by internal resources. A core finding in this field is that self-esteem acts as a critical mediator linking the positive changes experienced after divorce, such as changes in self-perception and relating to others, to subsequent subjective well-being and happiness. Self-esteem is essentially the sense of competence that allows the individual to cognitively process the trauma and balance their affective states. High self-esteem provides the necessary personal resource to convert hardship into psychological advancement. Women who achieve positive adaptation actively embrace several behavioral strategies. 1. Goal setting and independence. They focus on personal development, set future goals, and demonstrate a pride in their capability to be independent. Some, facing financial pressure, successfully endeavor to build their own businesses. 2. Cognitive reframing. They prioritize self-care and cultivate gratitude, viewing change as an opportunity for transformation rather than loss, thereby shifting their mindset towards optimism. 3. Support network development. They actively build strong social support systems, acknowledging that support from family and friends is essential for adaptation. While navigating new relationships is challenging, those who repartner successfully tend to report lower depressive symptoms than those who remain single. The stability and long-term health of the former wife hinge on her ability to successfully execute the psychological reorganization. The data is clear. This path is obstructed less by deep, singular emotional distress and more by the constant accumulation of daily, logistical, and financial pressures. To support the transition toward post-traumatic growth and stable functioning, the goal for the former spouse is not emotional intervention, but the active mitigation of external obstacles. According to principles of behavioral change, a persuasive call to action must respect individual autonomy and avoid implying a loss of freedom, thereby minimizing psychological reactance. To facilitate the successful adaptation and autonomy of the former wife, commit to reducing logistical friction and eliminating systemic ambiguities. This means establishing reliable, low-conflict co-parenting logistics, ensuring predictable financial stability, and respecting her independent development. By consistently minimizing the pileup of stressors, the former partner ensures that the ex-wife's finite psychological resources are channeled into the critical, long-term work of self-redefinition, ultimately leading to greater overall stability for the entire post-divorce family system.